See if you can see it on YouTube. That's it, ain't it?
That's my phone. Yeah, I guess that's it.
I just switched shots.
Alright. Looks like I'm getting it.
Wow. I'll take it.
That's great.
I'll take it. And I just went straight from her. I did my homework.
Did you change something? Because you did more than you did yesterday. Wasn't that the restriction they had about
Yeah, I mean, we're only 55, we're only 35 minutes out. But I'll stop it. We'll start it back at 6:15, or whenever they let us in.
Set up in the room. Yes, please.
It is, yeah, just says we are live through YouTube.
No, okay. No, we're inside the room. And if you look below, there are people.
So Charles, you should tell me, you're going to YouTube. Maybe YouTube. You're looking
Go
for
to the district YouTube.
Go to the district.
I have not been together.
You was on it.
Okay, we just tested a little while ago, and it showed up.
Jackpot.
It's gonna be a little while.
Okay, we got 31 people on. You ready to go?
Ready?
Okay, thank you. Well, hang on first, because the board's got to be ready now. And we'll be ready. Thank you, Carl. Okay,
I
how do you want me to
asked,
handle
is
this?
there going to be some kind of COVID curriculum? So when kids come back, we spend some time
Yeah,
talking
so-
about it and some expectations.
So you're hearing it, Tom's got
If we
it.
get to that point,
I'm sending it to
Yeah,
Charles.
we don't
You
know.
want me to ask?
You'll be able to hear. You can do something.
Okay. President Rhodey Collins, could you say something on your mic?
Make sure we ask today.
Can you say something?
Can I? Yes, I was like.
Hello?
Okay, can you hear her now?
Hello?
There you go. Okay, we're good, thank you, thank you.
Excellent.
Oh, that's so lovely.
Hey, Lori, we're not live.
Huh?
Are we live right now?
Actually, yes.
We're, yes, we just got on live to test.
Hold on. No, where is that coming from?
Until the sound. I think
Why is that different? Oh, no, I am muted. Oh my God. Why is it?
So it's not coming out of your
Would like to call this meeting to order. Ms. Lewis, could we have roll call, please?
Ms. D. Jones. Ms. S. Jones. Mr. Lang.
Here.
Dr. Roberts.
Present.
Mrs. Val. Mrs. Val. President Rhodey Collins.
I can't. Okay.
Thank you. We have a quorum.
Oh, there it is. I don't know how to do it on the iPad. Okay. Did you call my name, Ms. Lewis?
Yes, ma'am.
You did. Okay. Yes, I am present. Okay. Moving on to student and staff recognitions. Dr. Adams.
Good evening. I would like to start by thanking Dr. Echols for his leadership as Director of City of St. Louis Health Department. His guidance has been invaluable as we developed our plan for the 2021 school year. Additionally, I would like to thank the members of the Restart School Task Force for their hours of hard work to look at every angle and share their recommendations for restarting schools. Again, I want to say thank you. A special note for our families: Missouri law requires that children be up to date on their immunizations before reporting to school in the fall. To help our families accomplish this during a time when assessing health care can be challenging, the district is hosting a series of free immunization clinics for the St. Louis Public School students. The 3 dates that still remain: we have one on Saturday, July 15th at Gateway Middle, Thursday, July 16th at Oak Hill, and Saturday, July 18th again at Oak Hill. All clinics are open from 8 until noon, and the immunizations are free. Please reference the district website for additional information. And lastly, we have a really exciting date coming up. We will be celebrating the class of 2020 on Thursday, July 30th at Busch Stadium, the first ever graduation to be held at Busch. In the next few days, tickets and additional information will be sent out to graduates and their guests. We are looking forward to doing something really special to honor our graduates in person but socially distancing. There will be 2 ceremonies which will be live streamed, so plan to tune in and support our students. The board members received an invitation from me, so please let me know as soon as possible if you will be attending so I can make the appropriate arrangements. Thank you very much, Madam President.
Thank you. So the first order of business then is also with your superintendent report for the Restart Task Force update.
Madam President and Board and public, I'd like to provide you with an update, and I'll take my time on this presentation to give you a final Restart Task Force update and recommendation. The first slide that I would like to walk you through, would be a slide that talks about the purpose: to develop and present recommendations and considerations for the St. Louis Public Schools to ensure a smooth start to the 2020-21 year. The members of the task force included teachers, school leaders, district leaders, community leaders, parents, and nonprofit partners who represented SLP's wide range of schools. The co-chairs were Susan Reed, principal at Compton Drew, Karan Johnson, Addie Bond, and Square Watson. Karan Johnson representing Local 420, Addie Bond, a parent, and Square Watson, a member of the administrative team. There were 5 committees: governance, wellness, instruction, facilities, and technology with the 5 subcommittees. And there was a project management team made up of 3 members that are Mrs. Bao, who is an intern from Harvard University, Dr. Tyler Archer, and Ms. Angelique Roger, who was the assistant principal at CSMB. There were 10 guiding principles, and I won't read the guiding principles to you, but obviously number one is the notion of safety. The answers to those questions were posted today at 5 o'clock. There were over 1,000 questions that were directed to me. All of them, obviously, I could not answer, but about 180 we answered, and the other ones we clumped together, and they were placed on the website today at about 5:30 so that anyone can see what the questions were and some of the answers. Obviously, this is an issue that is unfolding on a daily basis, so the answers that are there now might change in 2, 3, 4 weeks or 2 or 3 or 4 days. We established district parameters for reopening and drafted some recommendations. In July, we updated all documents adhering to the official guidance announced by the DOH. Principals are going to be revising their plans because each principal came up with a plan. Principals report back on July the 16th, and they will be revising their plans. Part of their revision process is to include parents and teachers at the school as they look to revise their individual plans. The district restart framework is open to the public and feedback. After tonight's meeting, this presentation will be put on the website, and we will give the public an opportunity to give us feedback. We'll make any kind of revisions and obviously make some announcement on the 20th. That will be the final recommendation relative to what we do around opening schools. I need to frame clearly that this is an ever-changing recommendation. Some things might change that require us to do something different, but these are the recommendations as it relates to tonight. The next slide lays out the framework, but before I do that, the initial implication from experts were that the virus was really behind us. We had already hit wave 1. As you know, with the number of states that are having more cases and obviously more deaths that will follow, we're still in the initial phases of it. The late fall resurgence may still take place, and the belief is that there'll be ongoing waves moving forward. This was research-based, based on looking at research across the entire country. One of the key factors about us looking at our decision is the fact that research is indicating that about, as you look at the 4th-grade reading loss, approximately 34%, there will be a 34% decline in reading RTI scores, equivalent to about 6 months of learning loss. As it relates to math loss, expect an 81% decline in math RTI scores, which represents about 14 months. And also that there will be an increase of 20% of the gap between the highest and lowest performing students. So the data is indicating that this is going to be a challenging time academically, obviously for the most neediest students, and obviously that will be a population that we support. Looking at data from Katrina, which was a similar kind of issue that happened in one particular locality, i.e. New Orleans or the Gulf Coast, 4 months learning loss occurred, and it took about 2 years before that loss was made up. So I'm only framing that to say that it is highly possible that this will take a long term before we're able to get students back to where they need to be. And it is one of the considerations that we took into account as we look to make a recommendation or some recommendations to the board. The City of St. Louis provided some operational guidelines, and some of the requirements you have in your packet, and I'll go over those: immunization, taking temperatures when someone is sick, social distancing, face coverings, hand washing, restroom usage, cleaning and disinfecting, school transportation, recess and sports. The second item we looked at was our own 10 principles. And so what I want to do right now is kind of walk through each area for the public and for the board. So St. Louis school operation guidelines for reentry. The district must have an infectious control plan, and that's a district-wide plan that we have put together, and the health department has to approve it. We have to establish a process which each school in our jurisdiction keeps and maintains accurate records. So anytime someone walks in the building, we have to keep a record of every single person coming in and what their temperatures were. We also are following the immunization guidelines of the state, which means that no student will be able to start school until that student has completed all of their immunizations. In the past, we've allowed students to come and stay as long as 3 or 4 months before we require that information. The health department is requiring us to make sure that that's done prior to any student starting, and that's why the announcement I made tonight of giving students an opportunity for immunization is such an important piece. At a minimum, maintain a 6-foot radius around each student's desk in the classroom. There's been a lot of questions about this, whether it's 6 feet or 3 feet. The health department in the city of St. Louis is allowing understanding that this is only one piece of the pie, meaning that 3 feet plus a mask, plus all the other kinds of things that are put in place will be sufficient. Obviously, if we have rooms that can accommodate 6 feet, that is what we will do, but it will be anywhere from 3 to 6 feet. Conduct daily health and temperature screenings for students and staff at the beginning of the school day. We've already purchased over 500 infrared thermometers for schools to be able to do that, as well as another 90 pieces of technology that allow persons to walk past and be screened as well. So those are some items that we've already purchased to try to address this particular issue. Minimizing contact and social mixing during school hours. That might mean eating breakfast in the classroom, eating lunch in the classroom, all of those kinds of things to minimize the contact that students would have. We would consult with the health department before we have any kind of function, so there would not be any large gatherings that would take place in our schools, no assemblies, no parent meetings, all of those kinds of things. And lastly, all faculty and staff would have to be tested prior to them coming back to school. My secretary and I took our tests on last Tuesday as an example of that, and we got our results back on Friday and Monday. So all staff members would have to be tested in this building and in schools before they would come back to school. We are sending out a memo tonight to that effect, but we did not want to do so without having this conversation tonight with the board. Some other additional guidelines: face coverings for all staff and students in grades 4 and above within the school building, and all students riding the bus, irrespective of the student's grade. On the bus, all students would have to have a mask on. 4th grade and above, students would have to have a mask on. Students with medical conditions that prohibit them from being able to wear face covering will be exempt as long as we have documentation to support that. We would establish an isolation area in every school. Who governs that isolation area would be dependent upon the resources at that particular school. It wouldn't necessarily be the nurse, but they would be manned by maybe the family community specialist or a teacher that might be off at that period of time, but the dynamics of the school would determine that. And we are meeting with the network superintendents tomorrow. Principals come back on Thursday to talk specifically about who that person might be. Again, requiring temperature and health screenings. In this particular building, starting on July 1st, every person coming in had to answer a series of questions and have their temperature taken as well. And as I said before, a record of that is taking place. We will prohibit visitation of non-essential visitors, meaning that all of the kind of tutoring and and they provide us with the information that they have passed they do not have a positive test. We will restrict all field trips. The likelihood is that all field trips will be virtual in nature, but not actually getting on a bus and going to a location. Again, I talked about this notion of complying with the Missouri statute governing community disease reporting requirements. There's some requirements that if persons have some kind of community disease, we have to report that, and that will go to the health department, who will report it to the Missouri Department of Education. Establish protocols for loading and unloading buses to minimize person-to-person contact. So all students will be able to ride the bus. There was some conversation about making sure that students were seating 1 seat apart. That is not a requirement at this point in time. It is a requirement that students wear a mask, and we will likely be assigning students seats on the bus, so we'll know who's sitting around them if someone does come with the particular virus. Ensuring safe and clean environments. Basic recommendations from the CDC. We will follow daily cleaning and disinfecting checklists. We have a number of new items we're using, such as foggers and all of those kinds of things to make sure that we are working to address that. Setting up for social distancing classrooms. We'll be measuring every classroom, determining how many kids can be in a room. Playgrounds, limiting the number of students who can play on the playgrounds. Communal areas as well. the cafeteria cleaning as well. Visitors, waiting areas, it is likely that visitors who come in will be placed in a designated area for them to pick up kids or wait outside while they call for the kid to be brought outside to them. And obviously, our vendor, first student, requiring them to clean the bus after every, not after every route, because it will be impossible to do that, but at the end of the day. Once they do the morning, all cleaning would take place. In the afternoon, all cleaning would take place as well, but not necessarily at this point in time after every single route, because they run 3 different tiers, and it will be impossible to do that after every single tier. At least at this point in time, we're still negotiating with them around what the expectations might be. Cleaning and disinfecting, I've kind of covered some of the things here, and I won't go over all of them at this point in time. Hand washing stations, similar to what you see in this building. We've ordered 300 hand washing stations so that persons can wash their hands. Sanitizing equipment, we've ordered 10,000 liters of that for classes as well. Electrostatic sprayers, foggers, and sponge applicators have already been purchased and are on order to come in. Custodial staff will be responsible for ensuring spaces are kept clean and disinfected. One of the great challenges we have is our staffing. We do have shortages in our custodial staff at this point in time. The idea is that we would have enough custodial staff to address a particular building. That is still up in debate right now, and it's something we're looking at closely, but we do have vacancies that exist today. In full transparency, staff members should assist this effort by cleaning and disinfecting communal areas. We will be requiring them to use whatever disinfectants that we approve, which they'll be provided, and facilities will coordinate, schedule, and deep clean any classroom. It may be required, and I want the board to be aware, that we may shorten the school day such that we could do the kind of cleaning that we need. We have banked into our schedule the ability to have more days than is required by the state, and in light of this particular virus, we may make some adjustment in the number of days, and I may be coming back to the board to make sure that we could do the kind of deep cleaning that we have to do in light of the fact that we have a shortages right now in our custodial staff. I won't necessarily go through all of this, but basically just indicate parents are asked to collaborate with the student health screenings. Students are required to have current immunizations and pop-up clinics that are taking place right now to try to address that. It is the intent right now to fill every single school with a full-time nurse, not necessarily a full-time social worker at this time, but a full-time nurse. Right now we have the ability to fill all schools with the exception of 5. Based on the data that I have today, obviously persons may go on leave, other kinds of things may occur, but at this point in time, we think we can meet that measure with 6 weeks out before school starts. Health guidelines, again, similar kind of things that I've already covered already. I won't necessarily go over all of these things again, but it's similar to what I've already said about what parents need to do and what students need to do as well. Data. I think Mr. Lang asked for some school-specific data, which is on your table, that lays out every single school and what the numbers were in terms of what they wanted to do. And you see in yellow the overall number, and then you see a percentage of persons who indicated they wanted brick and mortar, which means face-to-face, virtual, and admin. This is the overall data for the district, which is about 67%, representing about 15,319. It says on here we pulled the last data, which is about 15,000, I want to say 419, somewhere around that number, but we did it for every single school. So you have that, and that was as of last Thursday. That tells us what they want. Now, obviously, a lot has happened in terms of new information around what needs to happen or what doesn't need to happen. But at this point in time, the data that we have indicates that the majority of families want to come back to a school building, full-time, virtual, about 27%, and online, which is represent about 6%. It is our intent that a contract will be signed by parents over the next 3 weeks that will indicate to us what they will do, and they will be obligated to that fact for at least the first quarter. Mr. Saint-Omer is working on a document that I'll get in the next 2 or 3 days that we will be putting online for families to complete. We have 15,000 email addresses or texts, and so we have the ability to get this out in ways that we have not before, and so we believe that we can get accurate information with a deadline of the 30th of July such that we can make decisions around transportation, what faculty and staff looks like, what staff needs to be virtual and what staff needs to be brick and mortar. It is our intent that all staff will enter the building, and even if they're virtual, they are entering the building to go to their classroom or a designated area to do the online virtual instruction for students. This is promoting quality learning and technology equity, one-on-one technology, and I'll come back to that a little bit later. Consistent virtual learning platform. One of the board members asked for that. I'll provide all of the board members with a hard copy of that. That is still being tweaked, but I could get you a draft as early as tomorrow. We reviewed it a little bit today. Blended learning instructional framework, homeroom teachers for virtual learnings, and flexible enrollment options, which I'll cover all of these things rather quickly. If we talk about blended learning, we're talking about it could be part online, it could be part away from home. If it's part online, with some element of control over the time, place, path, or pace of their learning, so students could get online and get online at 12 o'clock at night, 2 o'clock in the morning. They could complete our online admin program at any point in time they want without face-to-face instruction. So these are kids who are doing it independent of much support. Part away from home, in part in a block and in a brick and mortar location away from home. That will be part of what a blended model could be, and along a learning path, which means that kids are following some scope and sequence independent of support. There will be modules that they need to complete. Some of the ways they can do it in a station rotation, lab rotation, individual rotation, flipped classroom where the student is doing the teaching and teachers are supporting that. It can be flexible, it could be a la carte, it could be enriched virtual. So there are a bunch of different options here that families will have as we look at the blended learning model. One-to-one technology, every kid pre-K through 8th grade will receive a device. Pre-K and up to grade 2nd, pre-K and first will, the device will remain in the classroom unless we go to 100% virtual because we have to shut down. Grades 3 through 8, the device will go home every single day. At the high school level, they will receive a Dell Latitude 3310 laptop, about 6,000 of those. Cost right now is about $4.2 million. Total for all of the technology support is about $4 million is what the cost is going to be. Wireless hotspots to families in need will also, we have about 3,000 available to families. The cost is about $9,200 a month. We will be covering that cost as well for families who still need it. Microsoft Teams will be utilized as a single platform throughout the district. Uniform expectations, integrated applications, standard professional development, and streamlining online. We've already done some professional development with staff. One of our challenges, or one of the things we're considering, is how do we make sure that all staff is in the same place. The idea of them coming into the building gives us an opportunity to continue to provide professional development to them. And homeroom teacher for virtual learning, all students attending school virtually will be assigned to a homeroom teacher at a school site to promote a home-school connection and provide social emotional learning support. If a student is online with the admin program, the idea is that they won't get the social work and counsel support, but if they're on the virtual program with Microsoft Teams, they will be connected to the school and still get any kind of social emotional support or any other kind of support they might need. The three options, again, won't read them to you for a student in terms of enrollment. In person, that means they come every single day. All courses will be utilized in standard-based curriculum. Families may choose to leave in-person enrollment and enter virtual. Basically, at almost any time, we're still tweaking that. We're talking about it at the quarter. Students will enroll in a school, but will engage in all learning virtually from home. All courses will be utilizing a standard-based curriculum as well, and families that select virtual learning may select to return in-person learning at each quarter. Because we have to make adjustments around staffing, so it is likely that the last bullet you see on virtual will likely be the same thing for in-person. That's why we're still having some discussion around that. And the admin program would be that students are only online 100% of the time, and they are looking at a standard and completing that. All courses and grade level standards will be required by the Missouri DESE, and that's what K-12 does and other kinds of programs. Our program, this is a new program that we're using, is working well in summer school at this point in time. Establish clear communications. How will the communication point of contact? It will be the superintendent, myself. What messages will be communicated, information about student safety and how district and schools will support it, when information will be shared, prior to the schedule for releasing information to be determined. All school employees are working with their supervisors who will in turn work with myself to vet and send information out. How communication will be carried out, again, I won't read all of this to you, but the multiple ways that we've used in the past will continue to be the ways that we try to get information out. Communication to parents, same thing, about the school start day, health and safety. After the 20th, the intent is that all of this information will be going out. Obviously, the board will have a lot of questions tonight. The public will be giving us feedback as well. We'll respond to that feedback and make any kind of adjustments. Families will be shared with the availability of community resources, mental health, child well-being, food security, medical, dental providers, and all of that kind of information. We're working on a plan right now with the around food service, such that if students are virtual, students may still be able to come to a location to pick up food. One of the big basic things that we're trying to make sure that we could tweak as well, because normally kids that are online virtual don't come to the school for any reason whatsoever, but parents may be able to come with a student ID. We're working with the state to look at that, to pick up food such that they could have food for 7 days, similar to what we're doing right now. This, again, talks about the multiple ways that we're providing communication. It's a real big deal to try to make sure that we're giving as much information to families as we can. One of the board members asked me to look at the day in the life of a teacher. This kind of lays out the day in the life of a teacher. If a teacher is in person and a teacher is virtual. We've also done this for a student as well. I just didn't include it in this particular document. We'll be putting it on our website as well. But it just basically lays out what a teacher has to do. Starting at 8 o'clock in the morning in terms of 6 feet of distancing, checking temperature, totally different than what a teacher would do today. One virtual and one in person. That kind of lays out so parents, when they make a choice, they'll know exactly what their children are dealing with, and staff, as they make choices as well, they'll know what they're dealing with. Right now, it is our intent that the school leader will determine what teacher will be virtual and what teacher will be an in-person teacher. We're not looking right now at an A-B schedule. That might change over the next 2 or 3 days. As you know, I've reported before, we meet with the health director every Wednesday. Every Wednesday at 8 o'clock in the morning, and with co-superintendents, other superintendents around the region, every single Wednesday at 9 o'clock. So I'll be getting updates as well. I want to be really clear here that this is changing on a daily basis. So what I'm telling you tonight might change before the 20th. That's how fast information is coming in around data, around cases. Obviously, we had a number of teachers who were here on yesterday who were concerned about coming back to brick and mortar. We want to be cognizant of that as well. You have a companion document that I sent to you as well, and it looks like this. It says St. Louis Public Schools Restart School Framework and Recommendations. That particular document, yes, sir, I'm sorry.
The example of the virtual teacher and the in-person teacher, just so it's clear, they're both in the building. Right?
Yes, sir. That is correct. They're both in the building. One is simply not interfacing with students at all. They're going to their room, they're turning on the computer, they have hours, they're working with kids, they leave at the end of the day just like anybody else will leave at the end of the day. Yes, sir, that is 100% correct. The document you have right here is a document that lays out, it's a 25-page document that lays out all of the details around everything. We're still tweaking it, that's why it says do not copy. We will also put this on the website as well once we complete the document, but all of the information is here. When will teachers determine if they want to still work for the district because they have concerns about their health? There's an August 2nd date in here that kind of lays out that that's the date, because we do need to know about staffing, but it lays out everything. And so this is going to be online as well for faculty and staff and parents to give us feedback, with a final document being released on the 20th. My colleagues around the region will also be releasing their plans on the 20th. This is not a final plan. This is an update from the Restart Committee. They did an excellent job of vetting everything that they could. But at this point in time, these are the recommendations that I'm bringing before the board based on information we have today. I want to clarify again, based on information I have today. Something might change between now and Friday. I want to try to give as much information to the board as you might want to get, and I'll take any kind of questions that the board might have. Just to add a couple of things, we've spent about $550,000 as it relates to masks. We have 117 masks, 117 gloves. We have 500 thermometers, as I indicated before, but I can provide that list to the board as well in terms of all of the things that we've purchased. Face guards as well. I want to say 2,000 face guards for our security and those custodians who are in spaces. So we have all of the equipment that it's necessary to support our staff at this point in time in terms of PPE equipment, and that's what is required. So we are making sure that every student will get 3 masks, and we're talking cloth masks. Not counting the blue masks that we wear. We have 100, and, as I said, 17 of those, 50 cloth masks that kids will get, 2 to 3. The health department is requiring that. Each staff member will get that as well. But we're working on every single angle to do our best to make sure that we're supporting staff and students. And I know even with all of those things, there are a lot of concerns because this is a novel virus, meaning that there's not a lot of information on it, especially since we left on March the 13th, and students have not been clustered together in any kind of environment for a long period of time at this point in time. I did not talk about sports because we're still working with the health department around sports. Will there be football? Will there be basketball? We don't know right now. We're still working with the health department. Fortunately enough, they don't actually start practice until August the 10th. They are training right now, and they are in pods, and we have all information. The parents have signed waivers, and they can do distance kind of workouts, but not in any kind of organized way. They're not hitting each other. They're not touching each other. They're not throwing basketballs or footballs or any of those kinds of things, soccer balls, none of those kinds of things at this point in time. So questions that the board would have, I'm sure you have plenty.
Okay, just along that last point, so with the sports, you said you're working with the health department and other schools. You said you're working with the health department and the other schools. Has the Missouri High School Sports Association or any of the lower grade level associations been involved with that at all?
Yes, sir. Right now, the Missouri High School Association has said this is a local decision made by the health director. So at this point in time, they're saying statewide, do what you want to do. You could practice, follow the guidelines, but the health director will determine in every local municipality what actually the guidelines will be. Example, the decision to the local municipality, and they'll make those local decisions.
I think Donna has a question.
Might be easier for you just to repeat it. It's kind of hard to hear.
I can hear you, Donna. Go ahead.
We want to, believe that everybody's going to do the right thing that they have not. So who's going to make that recommendation that things do change so much? A lot of energy into the first.
So she's saying there's currently 3 options, brick and mortar, virtual, and the Edmentum. But what would it take for the district to be fully virtual, and who would make that recommendation, or who would essentially be in charge of making that decision?
I would make a recommendation to the board, similar to what I'm doing right now, regarding what needs to happen and justify that with information and data. I want to clarify some things because I do think that is a great question. The board, I'm making a recommendation to the board that this is what is likely we're going to do today. Between now and Thursday, I have to talk to the health director tomorrow. Numbers may have increased, and he may come back with another recommendation. But the board would have to say, this is what we want to happen. We're not accepting the superintendent's recommendation. We want this to happen and to vote in that venue. We would have to then make some determination, but there are multiple determinations that have to be made. Number one, do we continue to pay employees who are not necessarily going to be before students? I will not need custodians if buildings are not going to be open initially. I would not need secretaries, at least full-time, if we're not going to be in buildings. I will not need 136 security built people who are not in buildings, and I may not need all teachers as well. So support staff would have to be impacted. So we would have to go down a decision tree to determine about what virtual means. We will still likely have to bring teachers back in to do training with them because we've not had any training with a number of brand new teachers. As you know, we lose about 200 teachers every single year. We hire about 200 every year. And so we would have to walk them through the curriculum. So there would still be some opportunity for teachers to be trained, early on, and then we would still likely make a recommendation for teachers, even if we were going 100% virtual, for them to come to the school building in their classroom to provide that virtual instruction, even if we were 100% virtual. So we're going to do the survey again. Ms. Jones, it's possible that the survey may come back that 30% of the families want a brick and mortar, meaning coming to a school, and 70% want virtual. I think it's critical and important that we try to be as responsive as we can to our student population and parents. Many parents cannot work if kids are at home, especially at a young age, and so I think it is incumbent on us to try to be as accommodating as possible. I know that there are risks, and I stay up all night thinking about this, and what we're going to do is, I know the board has been inundated as well with a number of requests, but I think the health director, unless the health director says schools closed down 100%, it's going to be up to this board, up to this superintendent to make a recommendation, and this board to say yes or no. So ultimately, Ms. Jones, it's the board's decision after the superintendent makes a recommendation.
I have a question.
So her question is, are there the concern about childcare, and are there entities in the community that would step up to help with childcare? I'm assuming you mean in the event we went 100% virtual?
Over the summer, there were a minimal number of, the question is, would there be entities that could help with child care? There were a minimal number of systems in place to support those families. A lot of the child care agencies also had some issues with having kids in place. What the data indicates, Ms. Jones and board, is that at this point in time, across other countries that have opened up, it seems that younger children do not get the virus. They obviously can be transmitters of the virus to adults, but we have not leveraged them at this point in time to determine how many might be available to open to support kids in the quote-unquote child care kind of space. But it would be our obligation for kids K through 12. Those vendors could likely do pre-K and grades ages 3 and 4, but K-12 is going to be our responsibility.
Natalie? Has there been a preference survey distributed to teachers regarding their comfort level with in-person or virtual, and then using that data for staffing?
We have not surveyed teachers at all at this point in time.
Okay. So thank you for the presentation, Dr. Adams. I just want to ask a question regarding, because you were explaining that we would have to bring the teachers in to give them some further training on how to do the online virtual learning. And so I'm wondering, what have we done since the school has let out to be more innovative in our technology, so that our teachers do not, maybe don't have to come back into the building to get the training, and or I'm very interested in, as you know, I've expressed before, in us having some type of streamlined videos that are district-wide as it relates to showing our parents how certain technologies work, showing our teachers how certain programs and technologies work, having a certain area on our website that says these are all the resources that we're going to be using for the specific grades, or however that looks. But everything that we have should be pretty much across the board and readily available. So I just want to know where we are with that.
So 35 teachers have been working on that particular platform, as you've indicated, and they've been working teaching high school, summer school right now online for half the day, and the other half of the day they're working on exactly what you're talking about. The platforms that they're using right now, at least the training, has been voluntary because teachers are not working. And so we have had a large number of teachers who have engaged, but it is not required. I would think the numbers are around 20%, 30%, but teachers are not required to do the training right now. It is whole 100% optional. But to your point, we are training teachers and working with teachers right now, but there's a pool of teachers who are creating all of those kinds of things. Again, we're 6 weeks before school starts, and they're supposed to come back on the 17th of August. It will be our intent that that will be completed by that time. If we have to go to a modality that you're talking about, which is 100% online, we still have to do some training face-to-face with them, because many of our teachers have not, obviously, I want to be really transparent here. As a nation, the data indicates that we did not do a good job when we moved from March 13 to do online, and that's not just in St. Louis or the region, that was across the entire country. The New York Times did an article that we failed in that across the country. And so it would be my preference and required that we would have teachers in an environment where we can train them and make sure that they can turnkey this adequately to students. So we have done some of it, but I still think, irrespective of us trying to do it 100% online through Zoom, that we would have to bring them into an environment that they can ask questions. Obviously in a small group, similar to what we're doing here for a board meeting, we wouldn't have 100 teachers. We would likely have a small number of teachers coming back to go through training while they actually do it. That's one of the pieces. The other piece is we have to really look at what we do with PE teachers, art teachers, music teachers, because their curriculum in and of itself doesn't necessarily turnkey into being online in that kind of way. We struggled with that as well last year, and we severely struggled with special needs kids who could not get OT, PT, and all of the kinds of things that they need to have. So even if we decide to do virtual, it would be my strong recommendation that those families that are most marginalized, because the research says it's across the country, as this has happened in other countries, that ELL students, as well as our special needs kids, would actually have to come to a building to get instruction, because they cannot necessarily go online and get OT, PT, speech support in a way that they need to. We struggle with that across this entire country. So even if we decide to go virtual, it would be my strong recommendation that we will give families that have the greatest need some choices that they would have to make, along with support from teachers, because I know the question has come up. I've gotten 1,000 emails about we've never surveyed teachers. A part of the challenge is teachers have contracts and they're obligated to provide instruction. And if I get 10% that say they want to come back, do I take that data and not require us to educate kids? The answer is no. We still have to do that. That's our commitment to do that. So ultimately, we would have to look at, if we decide to go virtual, Ms. Jones, we still would have to look at, I think, some option to give the neediest families an opportunity to come to get the kind of support they need.
Okay, and just, I'm going to let everybody else ask questions because I definitely have more. But so I know that last time we looked at the responses, they were fairly low. And so I'm just curious to know where our greatest response came from as relates to family survey responses.
About 73%, as you see there. I want to say there were about 5, and you have the data in front of you, 5 to 7 schools that were under 50%.
I guess I'm wondering, like, the channels. So were they received like email? Were these done through online input? How do we get the information?
So we did multiple things. Number one, we sent emails to them because many of them had signed up for technology. That was number one. And the way I got it to increase is that I had principals call them one-on-one, because we were doing it from a district level. Well, really, we always did it from a school level, because the initial numbers we got were based on 3 or 4 or 5 days. We kept it open until last Thursday, I think it was. And so we pushed really hard with principals to get as much data as possible, even if we called Dr. Roberts on the phone and say, Dr. Roberts, you have not selected, I don't have internet access. So tell me, what would you want to do? Do you want virtual? Let me explain it to you. So secretaries will call back in. We paid extra service for that. Assistant principals will call back in. So they actually did the phone calling in some cases to get the numbers higher, because we needed to get good, accurate information.
Got you. And then the last one to follow up with that is, I know that as it relates to, like, on page 14, it says prioritizing student well-being. And we talk about social and emotional support. And I know that in your presentation, you just stated that, we're going to try to have, nurses at each school building, but I would also say that we need social workers as well at every single building along with that. And if this is not happening, what are we doing to get these specific individuals inside of our schools and or that will be able to provide that support online?
So on August I want to say 7th and 2 days, we have our volunteer community service people coming for a Zoom meeting. I think Mrs. Willis is managing that piece. We have to get them cleared first, meaning that they've taken the test to say that they don't have the virus, and they'll organize somebody coming to a particular building but knowing it's the same exact person. So we're all working on a strategy to do that. Many of them want to come back to our buildings. Some, like teachers, don't want to come back to the buildings. I'll give an example. Oasis, which is normally an older group of tutors, are not necessarily coming back to our buildings because they feel that they may be impacted by coming back. They're older group, 70, 80 years old, and that's not a disrespectful term, but that's basically the retired.
Around the buses, so I'll start with this and I'll hear what your response is. But since this is the initial plan, I would again urge the school restart task force to think about busing. According to the presentation, there is no requirement that students social distance on the buses. And as a lot of these plans are coming out from, sports leagues and organizations, they've been noting the inconsistencies in that. So if we're not going to require them to social distance and separate themselves on a bus to school, how much sense does it make if we're asking them to then stay 6 feet apart in the school? So I think there needs to be consistency there. And even the public transportation systems are marking off, sit here, don't sit here. The restaurants are doing the same, and they're limiting the amount. So I would really urge the school restart task force to think about that, because I would hate to think that not being able to ride the bus safely, that be a reason why families choose not to send their children to school. So I don't know if that means more buses. I don't know if that means that we have to change the route. So if we do start later, maybe there are different waves even along the same route. If we look at what routes have the most students that we can break up. But I think it's not a smart idea to not social distance on their way to school and then tell them they have to stay apart during school. And along that same vein with the playgrounds, I'm just wondering how that works. So even if we send 10 kids out there, are we telling them to play 10 feet or 6 feet apart? It's just strange to me. Of course, I understand the kids need to have their activity, but I'm just wondering if we're just going to have teachers yelling at kids to stay 6 feet apart the entire recess. And I'll stop there.
So I'll address the first one as it relates to transportation. What the health director said to us is, while it would be preferable that we would do every other seat, it is not practical. And the fact is that if a kid has on a mask, this is a layer effect. One specific thing like social distancing, in and of itself is not going to solve the problem. So the notion of wearing a mask, keeping kids on the same seat as they ride the bus is the best option relative to what schools districts have to do. None of us, even if we wanted to, could double 276 buses to get to 552, whatever that number might be. So that is what the health director recommended, not just for St. Louis Public Schools, but the entire region, because it's almost impossible. So one single act of social distancing is not going to solve the problem. Masks will be one way, in addition to kids sitting consistently in the same seat. And if Calvin Adams comes up with the virus, contact tracing will say that Dr. Roberts was sitting next to him, because that's the bus he's on, so they're easier to track where that kid is or what other kids might be impacted. So that's what the health director said to us, and that is why he made that recommendation. As it relates to and the other matter was, I'm sorry, Mr. Lang, it was the bus, and the other one was?
Playgrounds. But I mean, if that's a justification for the buses, I can only understand or imagine what it's going to be for the playgrounds.
Exactly.
And I understand that, but again, to your point of,
What we're finding, however, is that kids are still interacting in neighborhoods and other places. And so the challenge for us, board and public as well, is what's the best options we have relative to the resources that are available, and how do we best use those resources? we would have to your point, increase the number of buses, or at least increase the number of routes that would need to take place. And we have not had a conversation with First Student at this point in time. But that if that is a recommendation the board wants me to come back to look at, I can do that. But I can tell you right now, it would be a substantial piece as it relates to that. In terms of playgrounds, again, the health director said the same thing. If kids are wearing masks, and it's the same group of kids, and that's why we try to keep all of the kids together every single day in the same rooms, whether it's breakfast, lunch, and those kinds of things, then it's much easier to contact trace that group of kids. So I think all great questions, Mr. Lang, that the Restart Committee looked at, that we looked at, and asked the health professionals specifically at the local level and also CDC as well, and that is the kind of information that we've gotten back so far.
Dr. Roberts, do you have any questions?
It's on now.
Okay. And everyone who participated put out some really great recommendations into this draft document. I did submit to Dr. Adams a page and a half of questions, and many of the responses to my questions were, we will review this as a draft, or we will address, or DESE would provide guidelines. And so at this point, I'm interested in perhaps Dr. Adams coming back to you again with these questions for a little more clarity and depth in the responses. Right now, it's just kind of a gray area for me.
Yes, ma'am. I got the questions this weekend, and I worked on the quasi responses. Have a staff meeting today. I'll have one tomorrow at 10 o'clock, and I'll have firm answers for you by tomorrow afternoon on all of the questions that you asked.
So I'll ask a question and then I'll come back through the line. I think my first question is, with this possibility, or if the board would move in the direction of being 100% virtual, could you share some of the impacts that we might see on attendance and how that's calculated and how that might affect the budget? I know you talked a little throughout your presentation about the potential of there having to be job cuts and things of that nature, but with the move to 100% virtual, I'm sure that would reach every aspect of this district and the way that schools are funded and schools are run by the state. So is there information at this point of how we might be affected if there were a move to that?
So on the attendance side, we got a recommendation from the state last week, Ms. Vanoy, regarding attendance. We think it might have minimal attendance impact right now. In terms of fiscal as well. A student has to pass this class, and then the attendance counts as like 92.94% attendance, but the kid has to pass the class as it relates to that. Obviously, there will be other impacts as well as it relates to our vendors, because they won't be engaged. As you know already, we had some conversations with one of our vendors that became a little tedious, and that will continue. And then we would have to talk about employees that are not necessarily engaged in the direct instruction to students. All of those will be factors that we would have to consider. As a matter of fact, I've asked legal to look at what all of those options might be. Don't have an answer for you right now, but we would have to think about what the implications are if we decided to do that. And the other piece that I want to clarify for the board as well, if I'm a parent right now and I must have brick and mortar, then I'm going to leave the district and go to a charter school or independent school or Catholic school that is offering that option. Because at this point in time, because no decisions have been made, but we're talking every Wednesday, there is a strong likelihood that every district in the county, as well as in the city, will provide dual options. Now, that's not confirmed, and so I'm not speaking out of term. It is likely for that to occur. Not a guarantee, but that is likely for that to occur. So there may be a secondary implication that occurs in light of the fact that the district is not a unilateral district in terms of being the only entity in the city that provides education to kids.
So these recommendations in this presentation were based on those conversations that you're having regionally with superintendents, and this presentation is in line with what you expect others to present? as far as having the options to choose based on at the family level?
I think right now, based on my last conversation with my colleagues, it is highly likely that, as of last week or 2 weeks ago, that is what everybody was looking at. But there's no guarantee. I want to be clear about this. Similar to me talking to my board tonight, they're having similar conversations with their board. And their boards are going to do exactly what you're doing, asking these kinds of questions that might change dramatically what they might be recommending. And also, when we made these kinds of recommendations, the uptick in terms of the number of cases in Missouri and across the country weren't as consistent as they've been over the last 5 days. So that is a factor as well that has to be considered, because if cases are going up right now, there may be more cases taking place with the lack of persons wearing masks and doing all those kinds of things. So to answer your question in a word, yes. What I'm recommending to you is what we have consistently kind of talked about as possible options as of a week or 2 weeks ago.
And you intend to, those conversations are continuing
Tomorrow
beyond
at 9 o'clock,
okay.
there will be a secondary conversation with my colleagues and also with the health department at 8 o'clock in the morning.
Great. Okay, I'm going to go back to the ones on Zoom, and then we'll come back down the line. Is that fine? Natalie? Question is about the current food distribution, when that is expected to, if there is currently a date that is going to end, and then if there is feedback from families regarding the timing of the food pickup, or I guess the availability of the food, and then the, I guess, quality and quantity of the food.
The last number I got as of yesterday was 2313. I think that still consists of around 2,300. It went down to about 1,700 for the 4th of July weekend.
Ms. Lewis, would it be possible for you to turn your volume down? I know your mic is off, but if you can turn the volume down. And then if, Donna, if you'll go back on mute. And we'll see if that's better.
Okay, at this point in time, we think the extension has been given to August the 31st to continue to do what we're doing now. There are about 2,300 families that are taking advantage of it. With the exception of the 4th of July weekend, it was about 1,700. We have not gotten any feedback back, Ms. Val, relative to the timing that the food is being provided or the quality of food. We've just not gotten anything back that I know of. I can talk to Mrs. Santiago, but at this point in time, I have not got anything negative back around the quality of the food or the quantity of the food or the timing that the food has been given out. And we've been doing this since the end of March, and so we've not had any, at least I've not gotten anything negative back relative to it.
Donna? She has two questions. I'm going to ask them separately because they're on different topics. So the first is, will first student use their cameras on the buses, or do they have cameras on the buses that they can use to monitor how effective these requirements are being, or like how well the requirements are being met?
Yes, they do have cameras on the bus, and the cameras look at everything that's on the bus. So if the kids are not wearing the mask, obviously we could get that information. But I think the health department is looking at this not as a punitive measure, but as a way to change behavior. And so I don't know that it's a quote-unquote punitive measure to throw kids off the bus. They will have masks to give to kids. We will give them masks, and they are also looking to give kids masks who come on without a mask on the bus, and also to the degree possible, make sure that kids are in the same seat that they will consistently be in every single day. That's the first question. The second question was, I think, about textbooks.
So the second question was, as it pertained to some of the comments from the teachers at the sit-in yesterday and their access to instructional materials. So is there an opportunity, and I think I heard you correctly, Donna, so if I didn't, let me know. Is there an opportunity to provide teachers with multiple sets of technology and textbooks and instructional materials so they can have sets at home and at school?
As far as technology, all teachers received a brand-new computer, and they're checking it out now. I think about 800, 1,000. How many? 935 have picked up their brand-new computer. They bring it back, the old one, they pick up a new one, and they've been coming all summer to do that. At this point in time, because we anticipate the possibility that we might have to be virtual again, all textbook curriculum is online. So a teacher will be able to go online and get the textbook curriculum for that particular textbook and not have an actual book in their hand. So that is what we have put in place for this year moving forward, that all of our curriculum is online such that the teacher can access it online.
Does that answer your question, Donna? So does that access to the online curriculum and textbook apply to students as well? And then would there be an option to parents to purchase a book in case they wanted a hard copy in the event they had internet access issues?
The answer about purchasing, I don't know. I need to check and see, because we may not even have the book if we are going to allow everybody to be online and access the curriculum online. They might could download it and save it to the hard drive. If they're using the Dells, I think with the apps, I don't think so. With the Apple, they don't have an opportunity to do that. I would have to check that answer because I think in some cases we opted to do online, especially for textbooks this year. We didn't purchase any books except replacement books. We didn't purchase any brand new textbook because everything was going to be online, because we knew kids likely would have to be forced to be virtual again. So I would have to get an answer to that question, and I think Ms. Willis, if somebody's writing it down, that I could get back with you on that.
But students have access to the online textbook?
They will,
okay.
Yes, ma'am. Online curriculum and textbooks, yes, ma'am.
Okay. Susan?
So this question is related to page 6, and it's discussing our reading loss and math loss. And I know this was attributed to looking at the projections of, what a prolonged COVID slack could look like. And so I'm wondering, what are we doing to tackle this virtually? And so what is our plan right now? And then also, are there any free resources that we can make available now to students in our district, seeing as though if you look at math, there's a 14-month learning loss, possible learning loss, and then with reading, a possible 6-month learning loss. So making sure that we have access, that our students have access to resources even when school is not quote-unquote in session.
So I will send you tonight or tomorrow the actual virtual document that Dr. Roberts asked for as well. There's a draft that lays out what we think we lost between March 13th and the end of the year. Mm-hmm. So we have laid out what we think kids have lost. 1,600 and I want to say 39 students emailed us and families and said, we want to keep our technology to work throughout the summer. Mm-hmm. We provided them with the curriculum. Those kids are using what you said, doing that kind of work based on what we gave them. Mm-hmm. Anyone else who did not respond back to us, we are collecting their equipment. Mm-hmm. We've collected 3,000 pieces right now, about 40, how much? 53% we've collected back. Those families who said, we want the technology, we will continue to use it, and we're monitoring that they're using it on the things that we want them to use it on, 1,639 kept it. Those who said, I will not be doing anything with this technology, we collected it back. So we tried to create some options, Ms. Jones, to give families who wanted to use it and said they were going to use it and are using it an option to keep it, and they're going to keep their technology all the way till we go back to school. Those who did not, we're collecting them every day from 8 until 12 out front. Families are dropping them off, or we're sending people to their homes to pick them up. So that is the extent of what we've done. We have 750 or so high school students who started on the 3rd of the 6th, I think it was 7/6, who are in summer school taking remedial courses right now. They were given technology and the curriculum, and they're working online with teachers right now, some 30 teachers. So those are the extents that we try to do to support kids such that their learning loss won't be there. But I think that learning loss gets a lot deeper if we don't get kids back in some kind of structured format in August.
Okay, and so just to follow up with this, if that's okay. So I know that when the question was asked initially about, if we went to strictly virtual online, virtual learning, that, possible secretaries, teachers, security, staff members would not, we might not need some of them. And so I don't know, I wouldn't agree with that, especially with the teachers, because if we're looking at the fact that we have a reading loss and a math loss, I'm thinking about that, the fact that I'm a parent of an SLPS kid, and when I was speaking with her teacher, and this is something that's happening across the district, that she's unable to do separate reading times for the kids that she needs to because of everything else that she has to do. So we would need to utilize those extra teachers to help, to boost up reading if this is an area that we're deficient in.
I am not disagreeing. Teachers probably, when I talked about teachers, I'm talking about those teachers who would be subject matter teachers that are teaching electives that are not necessarily aligned to the subject that you indicated. And I'm not saying yes or no to that. Obviously, we would have to come up with a plan about what a PE teacher does, what an art teacher does, what a music teacher does, and we would try to drive, as we did at the end of the year, some instruction to those teachers such that they are providing instruction to kids. So I'm not saying no or yes. I'm saying that is one of the things that we would have to look at. As I have not wrapped my head around what staff might be needed if we went to 100% virtual. It sounds like the board wants me to look at that, and we will be looking at that, but that wasn't one of the recommendations that came out of the Restart Committee. But obviously, we'll come back to the board, probably virtually, quite frankly, to kind of look at that as an option and what it might mean.
Okay, thank you, Dr. Adams.
Well, before my next question, just so I'm clear, I'm a little confused. So we said that the goal is, no matter what happens, that the district will be one-to-one in terms of technology, correct?
Yes, sir.
But we collected half the technology back?
Are you talking about during the summer?
Yeah. So I just don't understand why we made that effort to collect the technology back if we're going to one-to-one.
So two reasons. Number one, we had to make sure that we had enough technology to turn key and get back out in August. That's number one, because there were 8,000 pieces of equipment out, and so many families were not using the equipment at all, period. They didn't use it for summer school. They didn't use it for the regular school year. The equipment was not being used. We needed to get the equipment back such that we could clean it, update all the apps, do all of those kinds of things such that it could be ready to go out in the fall semester. So in the fall semester, everyone will be one-to-one, 100%. Every single student, every single teacher. And at this point in time, we're looking at pre-K through kindergarten, them using it daily in the classroom, and anything above that, them taking it home. If a family has not, returned the equipment, it is likely they won't get an opportunity to get another piece of equipment until that cost of that equipment is covered or some other arrangements are made. So that is the reason, Mr. Lang. And when I say one-to-one, we were not one-to-one over the summer. The idea is that we're one-to-one for the 2021 school year. That is what the one-to-one commitment is, with the Dell computers at the high school level, and at the K-8 level, the Apples, as well as at the middle school level, them having a keyboard. That is what the one-to-one commitment is for the 2021 school year. So the reason we took it back is not being used, number one, and number two, we needed to clean the equipment, get it ready, if you're not going to be using it, to go out for the fall semester.
Okay. So then I'll wrap these two together. So in the packet, there was a CIT, I think it was COVID intervention team or crisis intervention team, and it said that it would be made up of district staff, counselors, etc. So my question in this wrap, since the second part, is for this CIT team that is district-wide, are these people who are in schools that were pulling from their positions to be able to respond to COVID-related incidents?
They will be partially part of our staff and partially some of our volunteers, like a little bit alive and well in some of those entities. But we have a supervisor, Ms. Marietta, who will likely lead that team, similar to what we're doing right now. But to your point, the crisis team does already exist, and there are existing people in the school. We're looking to add some other persons to that team to try to address that issue. There's some legal issues that will prevent us from turning over some of that confidential information 100% to persons outside of our district.
Okay. I just want to make sure that counselors and social workers are also able to do counseling and social work, because I'm sure there are going to be a lot of crises as it relates to COVID. So then with that, the thing that I did not see in the plan is what is our response to the outbreak. So I saw that if a teacher comes down with COVID, that they, are no longer in the building. However, if I'm just think about my experience as a high school teacher, I have 4 classes a day. That's 4 different classes of students I've interacted with, and they've gone on to 4 different classrooms. So if a teacher, what is our protocol for that? So does everyone in the school get tested? Does the school go on shutdown for 2 weeks? What's our response?
Excellent question. It's one that a lot of persons have asked. The health department is going to give us some guidance. I'll send you a secondary document that's really about 50 or 60 pages. And on page 40 of that document, it will tell you exactly what the plan is if somebody comes down with something. But there's another companion document that I did not send to y'all because it's from the health department and it's really, really thick. I'll send that to y'all tonight. And on page 40 explicitly, you can see exactly what the schedule is, or what happens if somebody gets the virus and what happens. But on page 40 of the document I'll send you tonight, that came from the City Health Department. It's not included, Mr. Lang, in this document, but there is a companion document that comes with this.
Dr. Adams, you indicated that every staff person would be tested before returning to brick and mortar.
Yes, ma'am, that is correct.
Are they taking advantage of those locations?
Yes,
Are they
ma'am,
going to those same locations
yes,
that you
ma'am, that is
identified
correct.
for students?
Yes, ma'am. The city is setting up locations for us to use, and it is likely that we will use some of our schools as well. We've asked them, since we have 3,800 employees, the third largest employee in the city, that some of the testing will take place in our buildings, and the entities will be coming in and testing persons and giving us the results in 3 to 5, 7 days, depending on what the time may be. But we will be using those clinics as well as our own schools that will be locations as well.
Okay. And that information is readily available on the website now?
It is not available until tonight.
Tonight.
And so I wanted to have this conversation with the board first. We completed the document last week, but we decided to wait until tonight to send that information out. Initially to principals and central office staff, because they're the ones that are most impacted right away, because they're coming back on Thursday, and then it will be turnkey to the entire staff.
So first of all, thank you to you and to your entire team that I know has spent millions of hours putting this together, and using the resources here that you've shared with us, that you've used as reference, because I think everyone recognizes this, but I think it is important to say is that there is no guidebook for how to react to this. And so it is everyone taking calculated risks and trying to determine, based on the information that we have today, what is the best plan for 6 weeks from now, and who are the experts, and how can we rely on their expertise to create a plan that makes sense. And also, as the parent of a child who is not neurotypical and has had some drastic regression in his just well-being in the time at home. I am so thankful that you're giving parents a choice of whether we are returning to school in person or whether students should be 100% virtual. So that, I think, is very important. My question, though, is seeing in these documents about like the My School component about how students will be assigned to a school. What I'm wondering is, are students being assigned to the school that they would have normally gone to? And then if a student is assigned to a school and then is opting to stay home this year, will they return to that same school in the following school year?
So yes, students who are assigned to a particular school this year, everybody, if you're on virtual, with the exception of Edmond, I think, and I got to make sure with Edmond, but every single kid is still assigned to that particular school. So at the end of the first quarter, if they want to come back to school because there are no outbreaks and they feel much more comfortable, they can obviously go back to that school. If a family has been accepted into XYZ magnet school and they decide not to go at all this year and go next year, it is my intent that their placement is still there. We'll ask them if they still want to go to that school the following year, but their placement will be there because we're staffing the school based on that number being there, and that the intent is that that kid will still remain at XYZ school. It's not an intent to move a kid to another school, period, or staff at this point in time. That might have to take place with some conversation, but at this point in time, that is not what we intend to do at all. I'm meeting with the network superintendents tomorrow in preparation for principals coming back on Thursday, and we're going to get into the finite details of what that looks like, but it is not the intent at all to move any kid from any location. That kid that's at that school now will remain at that particular school. And we will assign teachers based upon what the needs, or at least what the choices made by parents, if they're virtual or if they're in brick and mortar. That is what the intent is right now.
That's great. Natalie or Donna, do you have any questions? Okay. Susan?
So this question is regarding the essential guidelines. And up under the conduct daily health and temperature screenings for students and staff at the beginning of the school day, we understand at least this about the virus is that everyone is not going to have a temperature. And so what does that process look like as it relates to, health screening? What does that look like?
That's an excellent question. There are a series of about 7 questions that every child will be asked. Have you come in contact with somebody with the virus? Do you still have taste? I get it every single day that I come in. The series of 7 questions, then they take the temperature. You are correct. The health professionals have told us this is low bar. You could have not have a temperature and still have the virus. You could not have all of those things, but they see this as a low bar, and the screening is, I don't want to call it perfunctory because that's not the right word, but it's low bar, and you might get a small number of kids that hit that. And one of my colleagues who started and opened up, they found out that a number of kids were coming in, let's say with 101 temperature, and they send that kid to the doctor, and the kid still came back without having any kind of virus. But you are correct, but it is a requirement that the city is putting in place for every person coming into a building, but they believe that because it seems that our population is, and they didn't say this, I'm saying this, so I want to be clear about it. We have a large African-American population. It seems that African-Americans are more impacted by this virus than persons who are not African-American, so they want to make sure they have all of the precautions to try to make sure that they are covering everybody, even if it's 1% or 0.001%. That kid is going to be excluded from the environment if he has a temperature, if he says he doesn't have taste, if he says he's been around somebody else, and placed in an isolation room and then brought home or picked up. So you are correct. A kid could take a test today and not have the virus and test tomorrow and have the virus. But these are the precautions that the health department is looking at, and so we are following what they say in this particular case.
Okay. Thank you, Dr. Adams.
The same thing is may not take place in a county. It may take place in a city. It may not take place in Illinois. Every health director has a different view of the screenings of these kinds of things.
Understood. Thank you, Dr. Adams. And so my follow-up question to that is on the page 11 for the essential guidelines. And so I'm wondering, are masks going to be given every day? Are these disposable masks? Will they be given prior to the school day? How will they be distributed?
So likely on the first day of school, students will be given masks as they walk in if they don't have a mask. We will give every single kid at least 2 cloth masks, which means that they can wash them and bring them back. Then we have 107 disposable masks that they can wear. The health director said 2 or 3 days if they don't have a mask, but we will have an ample number of masks to give out to kids such that we don't want the masks to prevent them from getting a quality education. So 2 things, we give a cloth mask initially, and then we follow with other disposable masks as kids come every single day. But the intent is to change the behavior such that that kid doesn't leave home without having a mask. So we'll do both, Ms. Jones. We'll give disposables when necessary, and we'll give permanent masks for kids who we believe, we'll give every kid a permanent mask as well.
Okay. Thank you, Dr. Adams.
Dr. Adams, that question brings me to number 12 on the list of questions that I provided. And I just simply asked about a COVID curriculum, and I wasn't meaning specifically some grandiose plan, but some discussion at the school level around COVID as it relates to social distancing, taking care of your mask, wearing it every day. And that's something that the school, to me, should be able to do during the brick and mortar transition.
Yes, ma'am. Thank you for the clarity. I wasn't clear about what that meant. But yes, the hand washing, the 6 feet of distancing, probably, not probably, Dr. Roberts, if kids are coming back to school, the first 3 or 4 or 5 days, that will be instituted every single day to make sure kids are doing that, in addition to the use of technology, how they use technology. Because while there were a lot of breaks in terms of parents not knowing how to use the technology, the kids didn't know how to use it either because they had not used it. So I think the deadline we say is September 4th is the time that we will have everybody with their technology. But the first 2 weeks of school, everybody will be using the technology in the classroom, become familiar with the apps, become familiar with using it, as well as, to your point, the training, if you will, around the COVID-19 curriculum. You should know, on yesterday, the health director was in our studio doing a taping for our population, meaning students, staff, and parents, that lays out what the virus is about. It has nothing to do with the school district. How do you get it? It's kind of like a taping to show how people get the virus, basically making people much more intelligent around the science of the virus more than anything else. And I want to indicate that Mr. Cummings from the union kind of encouraged that effort, but we will be putting something out on the website for anybody to go to from the health director. It has nothing to do with us other than it was taped in our building, so that faculty and staff can know, based on the information we have today, how the virus is transmitted, what you can do to prevent it from happening. And to Mr. Lang's point around masks on buses and that kind of stuff, that taping will talk about why, well, he won't talk about the transportation piece, but he'll talk about the layered effect around masks, around social distancing, and all of those other kinds, washing hands, all of those kinds of things put together will hopefully keep people from getting the virus.
Along those lines with the curriculum, one thing I asked for, I didn't see it in this plan, but I think is important. We approved a lot of MOUs with mental health and trauma organizations. I would love to see that implemented in this plan for that first couple of weeks, because again, we have a lot of students who school was their escape, and they were forced to be home, and we don't know what kind of situations they were forced to be in. And it's not, I don't think it's enough. I'm not saying it's what we're doing, but I don't think it's enough to just say, slap on a mask, stay 6 feet apart, everything is normal. I don't know what the details look like for those partners, and I know a lot of it depends on how we restart. But for that to be a priority, along with PPE, mental health and trauma assessments for students when they walk into the building. Well, not as they're walking into the building, but within those
2 weeks of time. Yeah.
Right.
Yes, sir. Yes, sir. I'll make sure that that's included. Maybe not as granular as what you're kind of articulating, because we do need to meet with them on August. Mrs. Willis, when is the date again? August? When is the date that we're meeting with the volunteers?
August 7th and August 10th.
And so we'll get some clarity around that prior to the next board meeting to kind of lay out what each one will be doing. In addition to that, at the next board meeting, you asked for Chad and for Mrs. Punch to come. They will be, I'll come and give a presentation before the board, and they will be a sample of what will be happening in the buildings. We've already reached out to them. The board approved this MOU based upon the September meeting that we had, and so they will be coming to do an actual presentation to the board and likely lay out some of those kinds of things.
Okay. And I have a couple recommendations, but a quick question that popped into my head. I know we ended school in March. Did students are the lockers cleaned out? We
cleaned out all of the lockers.
Oh, so there's stuff, okay.
Yes, we did.
That's
Yes, sir.
easy.
We will likely, and we're still working on this, teachers normally come back 5 days before. We may be allowing them to come back earlier because they didn't get a chance to, take everything out of their room and get it organized. If we decide to come back and not do 100% virtual, we will likely be requiring or asking them to come back a little bit earlier, or possibly even delaying the date from the 24th to a later day, such that teachers can have more time to get set up and ready.
Okay. And then in terms of the recommendations, and this might be a board thing that we discuss and consider, but I think it would be beneficial. You mentioned those ongoing costs and new costs that we're incurring. I think it would make sense for the board to see, at least on a monthly basis, what those recurring costs specifically related to just COVID-19 are. So with the funds that we're able to get for COVID relief, and I know that you all are making the plans to do that, but just seeing like what the trends are. So if that's increasing, then decreasing, are there things that we're spending more money than we thought we would? And especially with, again, PPE, hotspots, laptops, and those types of technology. I think that would be helpful for the board. I think and then the second thing, I'll stop at the second thing. The second thing would be, like you said, things are changing by the minute. I assume that a final plan packet will be available in every school in some capacity, but having an electronic version that is constantly updated, because if like you said, if it does go from 3 feet to 6 feet, we wouldn't want a parent to say, well, the principal told me this, and the principal was like, well, I didn't see it was updated. And then the third request would be a way for students, teachers, and families to report things. So for example, I'll be personal, I went into Qdoba, and workers had their mask down and they were supposed to have it up, but it was a simple let the manager know, and it was fixed. But if those things are things, again, we're talking about the health and safety of our students and our teachers, being able to report and say, hey, these protocols are not being followed and they need to be.
No, Mr. Lang, I think the last part, all of them were good points, but the last one is especially a good point. We don't have anything like that in our book. We do need to put something in there so that parents can report if they have a concern about how the requirements are being implemented. That is an excellent point, and we will add that to the book. In terms of the budget piece, starting next month, you're not getting it tonight because we just started in July. We're only 14 days in July. But every month starting in August, you will get a budget update about GOB. I'll add that to the budget update so you'll know what we've spent around this particular virus or what additional dollars we spend. But you will start getting that in August. That is the intent. And I think what is it called? The website with the chart with the that the board has asked for, I think that will be up as well this month as well. So, but yes, we will add that to the budget update that the board will start getting next month. That was a requirement from the ad hoc committee as well as the board president, and we will provide that to the board.
Thank you.
So I would love to hear a little more about what in-person instruction looks like. So I understand that it's all, or primarily all, will be based on technology, and the plan outlines that some portions of even in-person learning will be synchronous and asynchronous. So if you could estimate a little about like what percentage of time for in-person learners would be synchronous versus asynchronous, and then what modifications are being made to the curriculum for like early childhood or science, art, things that use manipulatives and touching. Like if we're doing it tech-based, what does that actually look like in practice?
So I don't know all of the details around it. Mrs. Mitchell is still working on that component. It is my understanding from the conversation we had today, because we had a leadership meeting today to kind of talk about some of these kinds of things. The teacher will be able to go back and forth depending on what the curriculum says around synchronous and asynchronous. A lot of it will be them using the technology to do this, because we're trying, at least initially, to get kids using the technology. But what I would like to do, Board President, is send all of you the virtual plan as a draft tonight, so you could kind of see and then ask any questions as it relates to that, because I've not been deeply engaged on the academic side around exactly what this looks like 100%. So I don't want to give you something and just to give you an answer. I would like the experts who are touching this every single day to kind of give you more feedback around it. But I can send you the document that we reviewed today that's exhaustive, that kind of walks through all of those kinds of things. And even with that, it's still a draft because that person officially started on July 1.
Natalie or Donna? Susan, do you have anything else?
Yes.
Okay.
So, forgive me if I misheard you. I'm referring to the restart planning process. And I know that the principals are given the autonomy to do their distancing plans at their school. And so were you referring to when you talked about the, let's see here, the verbiage around like a district-wide, I think, COVID-19 plan, was that including an infectious disease plan? Does that include a district-wide, like social distancing plan, like overall, or that was something completely different?
That is completely different. The infectious plan is what the health department is requiring from the district.
Okay.
And obviously it will hit every single school. So instead of every school coming up with their own infectious control plan, we're doing a district plan, which is part of our safety and security plan. Any way that we have to turn into the city, it is not specific to COVID-19. It's about any infection that might come, whether that's SARS or whether that's Ebola, but it is a plan that addresses what we do with any kind of virus that might impact us. This particular virus seems to be a respiratory virus, but there are other viruses that might be other kinds of viruses. So what they've asked for is an infectious control plan that's probably about 7 to 10 pages that lays out everything about what we do around any kind of infectious disease that we are encountering. And quite frankly, we already have one. We're tweaking it based upon this particular virus.
Okay. And so I guess as it relates to the building plans, is there a way for the district, or has it been considered that we would do like a basic district like plan so that there's something that the principals can have something to refer to and then kind of, cater it to their school?
That's already been done. They had the first plan. They all were due the 30th of June. We have copies of all of those based on information that we have now.
Okay.
At that time, they will come back on the 16th and 17th and update those based upon what we are recommending. If we recommend virtual, then there's no need for them to have Calvin Adams listed in their plan as the person who will screen for temperatures. So the details of what we decide to do will change their plan. But right now I have 72, what number of schools we have, 68 plans right now from every single school. I can get you one tonight to look at, but it has to be tweaked. In other words, I know right now at Henry School how many kids can fit in room 202 based on 6 feet. So I know what that looks like. I know what door they're going to be coming in. I know, based upon the information we had at that time, they put a 11 or 12-page plan that lays out all of that and lays out who the teachers are that's going to do this, what their roles and responsibilities will be, all of those details. They're going to now come back next week when principals come back and tweak it based upon what we recommend finally. So to answer your questions, we have a district infectious control plan, but we have a COVID-19 plan relative to this particular virus and how they are going to accommodate staff, students, parents, and the community to address this particular virus. So there are two different things we're talking about. Overall district plan and individual schools plans that address this particular issue. And I'll send all of y'all a copy of one tonight just to look at.
So I think when I'm discussing the school plans, that we were giving them a framework as something to go off of when it relates to them developing their plan.
They got a template and they filled in the template.
Got you.
Yep.
Okay, and then lastly, as relates to The virtual learning, I know, and if I'm correct, there was 2 hours required at the last part of the school year for our students. And so what would be the hours, the amount of hours that are required when the school year starts if there's virtual, well, when there is virtual learning, because we're offering that. And then if we have to turn around and go back home and nobody's inside the school, what do we foresee the turnaround time as relates to everybody being acclimated, into the program again?
So I'll take the second part first.
Okay.
We're going to start the school year as going to close in a week because
Okay.
we just don't know.
Mm-hmm.
So we're going to try to do our best to get everybody technology by September the 4th and to get everybody access to the websites and the apps and all of those things that they might need in case we have to close down. That's why I think it's critical that we at least get back in buildings in some way, shape, or form so people could get all of their equipment.
Mm-hmm.
The first part of the question was what? I'm sorry, I apologize. The first part was...
Let me refresh myself. How many hours of work
Oh,
would
got
it be
you.
required
Okay.
to complete?
I think it's going to vary. I think if we have teachers coming into the building from 8 until 3, all of those hours. We had struggles before last time because teachers had to set office hours. They had to do all of those kinds of things, and it was like a 2-hour piece of instruction. If we go back, the intent would be that teachers would be available during that school day, 8 to whatever time would be, to assist kids. They might have one set of kids, to your point, 10 kids might do 8 to 10, another set of kids might do 10 to 12, teachers might do lunch, and then another set of kids might do 1 to 2, while kids might be with the PE teacher online from whatever time to another time. So we have to work that piece out. That's why I do think it's critical that we do have some face time with teachers to structure all of that, because we've not been with teachers since March 13th. We've not had any holistic meetings with teachers at all since March 13th. They came back, they went and picked up the stuff out of their rooms, they threw stuff away, and then they left to go home, and we have not touched the large percentage of teachers except those who are volunteering to work, not volunteer, that we're paying to work with us, those who are teaching summer school and those who are going online on their own. So we do need some time with teachers in some kind of capacity to structure what we want the work to look like, because we just have not had time to interface with them since March 13th. So irrespective of what the board decides, it is going to be my strong recommendation, even if y'all decide y'all want to go with virtual 100%, that we have to have some time with teachers. So even doing that, we have to have some PD time with teachers, I think face-to-face, even in small groups, to get them where we need to get them.
Okay. My last question is relating to the food service. So if someone is in the Edmonton program, I know that they are not bound to a specific physical school. So are they still able to get food from the district if they're in that program?
So right now, we talked about that today, Ms. Jones. This is the dilemma that we talked about, and we have to frame this. Right now, the federal government seems to say, as it stands right now, the rules that we left in March, you have to be a kid picking up the food. Nobody else can pick up the food for you. You have to give your ID number. You have to punch it into a machine, and you get your food, and you sit down and eat. Obviously, they did a waiver for us in the whole country into August. We believe that waiver might be extended. If that waiver is extended, then Calvin Adams' parent has to go to the school and pick up the food and bring it back to the kid. If I am a kid and my parent and I don't want my kid to be interfacing because I think the kid might get the virus, does it make sense for me to come to that school where it is likely the virus is, if that's the belief, and pick up food and bring it back home? So we're kind of teasing what that might look like, that they may not go to the school to pick it up, but they go to some alternative place to pick it up. But we will not be able to drop it off to them. They would have to come pick it up. So one of the basic things that the research has indicated is we have to take care of the basic needs of kids, and so we are looking to see if we can provide food in that structure if a kid is online. That has not been confirmed yet. We still have to work through that. But that's the intent right now.
Okay. Thank you, Dr. Adams.
You're welcome.
Dr. Adams, very quickly, governance is the role of this body. We talked about this because it's a subcommittee also in the Restart Task Force. And so it may be confusing. And I'm not asking for an answer. I'm just putting that out there. And there's a recommendation of oversight in place of governance.
Yes, ma'am. I got your request.
Okay. And then on to the difference between Edmonton online and virtual. What's the difference?
So I'll take you to slide number 20. Adminum is a self-driven learning experience administered strictly online, web-based. Teachers provide very minimal support, so they may be available for 30 minutes to help. The virtual environment is the teachers there 100% of the time.
And they're using this same program?
No, they're using the district's curriculum as opposed to the Adminum program, which is a standards-based program, are much more aligned to a standards-based program.
Okay.
So there is some alignment in terms of the curriculum, but for the most part, if you want to think about it, Dr. Roberts, one is minimal support from teachers, one is maximum support for teachers. One is Calvin Adams is the teacher of record that I'm providing the support to. The other one, Calvin Adams, is not the teacher of record. I'm on this particular program, and once I finish it, I'm finished the course. I could finish it in 3 days, 3 weeks, 3 months. The virtual person is there the whole time. You're there for the whole year, finishing the curriculum, as opposed to Adminum. You can finish it when you finish it.
So we have two curriculums. That's what I'm trying to understand. Edmonton is a new one we just purchased, and I know that is self-directed, okay?
So
The
both
virtual is our in-house.
virtual is the teacher is actually following the curriculum with you. Adminum, you're doing it. It's still a standards-based curriculum, except that one is self-directed and one is directed by the teacher. That's basically what the difference is.
I got that part. I'm just trying to see if they are the same thing.
So you're asking if I line one up and say English 1, English 1 and English 1, is it the same curriculum?
Yeah,
Yes, my understanding it is the same
it's the
curriculum.
same thing.
Yes, ma'am.
Okay, well,
Yes,
that's the
ma'am.
clarity I'm trying to get out to the community.
Yes, ma'am.
Okay. This is
So now I'm a little confused. So I was under the impression that Edmonton was like a standalone platform. It's like a company that offers it. But virtual, that is our teachers doing our curriculum written by SLPS.
But they're both standards-based.
They're based on Missouri State standards,
Yes,
of
ma'am.
course.
Yes, ma'am.
But Edmonton is a company that we
Yeah, that is
are
correct.
contracting,
That is correct.
essentially contracting with, using their platform, and it would be their tech support. They're designing the learning lessons.
For the most
Virtual
part.
is,
The first one, they're doing it basically by themselves. The kid is actually going
Right.
through reading
so it's
the
like a
passage.
self-contained,
That is correct.
like, program.
And they can finish it at any point in time they complete it. But it's still a standards-based curriculum based on the Missouri standards.
Yes, okay.
And the last thing, Dr. Adams, the District Digest, which is a newsletter for families, I'd like to be included on that distribution list.
Done. Ms. Willis is listening. She'll make sure that the entire board gets a copy of it. I think it started last month, am I correct? Yeah.
Are there, do you have a question?
Yeah, and this is not governance, and I understand that, and it's getting a little bit into the weeds. But if I zoom out and thinking about marginalization and making sure we're being equity based, so I saw in the plan that there is some protocol for if a child, for containing a child that might be symptomatic. Which is fine, and then, but my question is just around, like, so a child walks into a building, let's say they're 12 years old, they come off the bus, they get a temperature check, they have a fever. There are, we have children in the district who might be taking care of themselves, and even though there are adults technically in the household, that is a real thing. So in the event that parent can't be reached to confirm that they don't have something or they can't be sent home, again, because I know this isn't really governance, I'm just urging that in the next iteration of the plan that there is consideration and provision made for circumstances where a child may not be able to turn around and walk out the door because it's unsafe for, of course, the rest of the kids if this student does have the virus, but also unsafe for that child himself if they have nowhere to go.
So your point is 100% correct. We talked about that today at my leadership meeting. If Calvin Adams comes in and Calvin Adams has a temperature and the mother's at work and we can't drop him off anywhere else because security will come and pick him up to drop him off. If a kid was on suspension and came to school, we would keep him in that building all day. The difference is the kid is going to be isolated from everybody else, but the kid will remain in school all day or until an adult can come get him or we can find somebody. But in no circumstances are we going to turn away a third grade kid to walk out and go home by himself. Unacceptable 100%. So that will never, ever, ever happen. Let me back up. It should never, ever, ever happen, but we're not sending kids home. Even if they have a fever, even if they have all of the kinds of things that are symptoms, we still are responsible for that kid, but he will or she will be isolated. For adults, if they come the same thing, we turn them around and tell them, staff member, I'm sorry, you can't stay, you have to go home. But for students, we will keep those students in the building. If we can't drop them off, even in our plan, we talked about, even if somebody drops them off like the security, 'cause that's the only one that could put them in the car and drive them home, that security has to have a mask on, that kid has to have a mask on, that kid sits in the back seat, and we bring the kid home. But we are trying to put precautions in place, but we will not, Mr. Lang, send a kid home without, we just won't send a kid home for any reason.
Okay, and I want to be clear, I understand that we don't do that
Right.
in non-pandemic circumstances, but I wanted to make sure with the threat of the virus that didn't change.
No, we're not going to, that's not safe for the kid, no.
I have one last question. As relates to the budgeting for our PPE supplies, how are we sourcing that? How are we sourcing the supplies? And what are the vendors we have gone with for our materials? Thank you.
I just happen to have one copy, but that gives you a copy of about $500,000 that we've spent so far, and the vendors and the order amounts and what we've ordered, and I could get a copy to every board member if they wanted, but I just happened to bring one tonight because I thought that question might come up.
Okay,
And so we're sourcing by RFPs. This is called an emergency, so we don't have to go through our normal process. Some of these vendors are part of Ed Plus, and so we simply go to a pre-approved vendor already that's already been indicated to have the lowest price. That's what most of those are.
Okay. Okay, that's fine. I just want to make sure that we are getting the best price on the products, and especially as it relates to saving money in our budget. And so I'll just review this, and then you and I can maybe just talk a little bit further.
Yes, ma'am.
Thank you.
And I can provide that to everybody, but that's as of today. I asked our procurement person to give me some update, and that gives you some idea.
Okay.
Looks like we can move on to budget, the budget
Oh,
update.
yes, I'm sorry. Thank you. I won't spend a lot of time here because obviously the information is preliminary. But on June 30th, the governor indicated some additional state restrictions. The foundation formula, which is 123-358-875. So same as June 1st, restrictions have been put in place. And so whole harmless waiver, normally whole harmless simply means that we were not going to be impacted as much because we already don't get a lot of money from the state. There are about 200 districts that are in that category, but he waived, as he did in June, the whole harmless. So every district, all 513 will be impacted. We anticipate, we don't know for sure right now because the state has not given us clear guidelines, but if it's exactly like it was in June, we think that we're going to be impacted about $5 million for the month of July, that we will have $5 million less coming to us than we had this time last year. So it just means that we have to be concerned about that as far as our budget is. And what Ms. Banks put here is that we're still purchasing all our one-on-one devices. We still are using some of our care dollars, hopefully, to spend on that. And it will continue to impact our virtual learning flexibility. And also to Mr. Lang's question, around care. You got some of it right there, but she's going to walk through everything.
We cannot.
We cannot. It's not allowed to do so. We can only use PP for COVID-19 related expenses. July, the governor may come back with another cut in August, but at this point in time, it's just June. As you know, that covered last year because that was the formula and all of that, but I just want to make the board aware of it. Don't have all the details right now because, again, we're only in, so yes, that's it.
So then if let's say that the $5 million number turns out to be accurate, would the budget presentation...
Ways that we see ourselves reducing our obligations.
Okay, great. So I'm asking that because I want to make sure we don't get to December and now we've lost $5 million a month and now, you know, we've gotten so far down that path. So we would be making decisions along the way based on the information that was available.
I will likely not be asking you the decision for July. No, ma'am.
Okay, great. So this is the portion of the meeting where we have public the COVID-19 pandemic and the core attention of this meeting. This procedure for submitting public comments will remain in effect until the City of St. Louis Health tomorrow when they are posted, and the rebroadcast of this meeting will be posted at that time. Are there any that you would like to take separately? Yes, so it's 7/14/2001. You have to do the numbers. Mr. Saint-Omer?
President Rhodey Collins,
Yes.
motion is passed.
And you got distributed prior to the work session in June. There were adjustments made based on board member feedback of facilities, and if that receives a second, then we can move into discussion. As it is for us, is there a second?
In terms of the process, who is able to make a petition? I see.
So there is a process specifically for petition. So this allows that with in any other policy with petitioning, there could be is actually limiting if they have to be started with a petition. So this doesn't. Other questions or discussion? Acceptance of those reports.
I'd like to move that we acceptance of the ad hoc budget committee reports.
Great, I'll second.
S. Jones,
Yes.
Mr. Lane,
Yes.
Dr. Roberts,
Yes.
Ms. Val. President Rhodey.
Things got a little behind us, as we can all under the ad hoc budget committee by a period of 3 months.
I'd like to make a motion that we extend the ad hoc committee, budget committee, that we extend the ad
I'll
hoc.
second. Questions or discussion?
Rhodey Collins,
Yes?
the motion is passed.
So the final item for committee is a proposed,
Standing Committee on Board Governance.
great, thank you. Is there a second?
Second.
Questions or discussion as it pertains? Adam?
My question, if the motion passes, how can it
Name representatives because it's a
hypothetically say we all were on the committee? Would that constitute a board meeting?
So we would have to notice it for sunshine law purposes because it is a standing committee of the board. So even if a quorum. Okay. Natalie? Susan?
Yes. So I was tasked with reaching out to is if you all are interested in doing a board retreat in person, or would you prefer this to be virtually? That's it twice? Online or virtual? In person or virtually?
So I'll let the other board members speak, but I do want to.
Yeah.
Is there anyone that wants to respond to Susan's request?
Thank you, Susan, for taking on the task, and I would like to meet in person, similar to what we're doing tonight. Is that important?
Thank you, Dr. Roberts.
So I feel similarly. I believe that doing a board retreat virtually would be a little complicated and kind of stifling probably of discussion.
Mm-hmm.
So I think it would be helpful for planning purposes to know, and also I think it's important that if we do a retreat, we'd want everyone to be present. So if the board is, if we aren't all comfortable doing it in person, that we might want to look at doing it at a later time when everyone would be able to come physically.
I agree with you. And so if you all don't have an answer tonight, if everyone could just get back with me and I'll follow up in an email by Friday of this week and let me know what your preference is, that would be great.
Any other feedback for Susan at this time? Donna, Natalie, Adam, anybody? Adam, do you have a board report?
No.
Dr. Roberts?
I do. I did participate in MSBA's Igniting Great Ideas Summit June 18th. And I also participated in the delegate assembly, as that is a requirement to completing professional development for school board members. My takeaway from the Igniting Great Ideas, there were 5 things about reentry that really made a lot of sense. One was respond. That's to convene, to discuss the situation and take necessary action, and I believe that's the leadership that Dr. Adams has provided. To revisit, and so the documents are in draft form. We've given feedback, and feedback is expected from the broader community, at which time you take time to discuss the priorities and anticipated results, reach out, provide information to stakeholders, listen and collaborate, regroup, be proactive, thinking longer term, consider necessary policy and plan adjustments, and lastly, to rethink and revise, reflect on lessons learned so far, consider opportunities for systemic improvement. And in closing, I just wanted to remind my board mates that as your representative to the Council of Great City Schools, I have forwarded to you 4 reports for your review. The IDA best practices during COVID-19 crisis, addressing mental health and social emotional wellness in the COVID-19 crisis, assessing language proficiency during extended school closures, and operational issues in reopening of schools during the COVID-19 crisis. And with that, Madam President, that concludes my report.
Thank you. So for my report, I'll just share about the Board Governance Committee. I will put this out in writing as well so you have it for reference. I will be needing to appoint a chair and an assistant chair of this committee. So if you are interested in doing that, I want to make sure anyone that we put in that role has the energy and the interest to take that on. It's a very important area that I think will bring a lot to the board. So please let me know if you have an interest in either of those things. The board president, it's not by this document we just approved, may not serve as the chair, so we will need someone to do that for the committee. And then once I've appointed those, we will work to schedule that first meeting, which again could be as soon as next week if that is the interest and availability of the board. Likely would be able to schedule that via Zoom or in person, depending on the will of the committee. Also, if you are interested or not interested in being a regular member of that committee, would be important feedback for me to have as well. Is there a motion to adjourn?
I'd like to make the motion that we adjourn.
I'll second. Ms. Lewis?
Ms. Donna Jones?
Yes.
Ms. S. Jones?
Yes.
Mr. Lang?
Yes.
Dr. Roberts?
Yes.
Mrs. Val?
Yes.
Mrs. Rhodey Collins?
Yes?
We are adjourned.
Great.